Hey friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who like to laugh, love their pets, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So welcome to the Dr. Molly Says podcast. Hello, friends. I'm turning the brightness down on my phone because every time I see clips from the podcast, it looks like I'm staring at the sun that's shining in my face. So I'm going to try to fix that. Hello, it is Halloween week. We're very excited about that at our house because I have a 4 and a 6-year-old human. And we are I've got a 4-year-old girl who's going to be a mermaid, which means she wants me to be a mermaid. So I'm being a mermaid this weekend. And then my 6-year-old is very into Minecraft, just the movie. So he is being a creeper, a Minecraft creeper. Never thought I would know what any of that means, but it's Halloween week. So we're going to talk about something scary today. We're going to talk about specific diseases, 2 of them. I told y'all I'm going to start trying to cover different types of cancer, which obviously is not something we like to talk about. But we're going to talk about 2 types of cancer that are things we see fairly regularly in general practice veterinary medicine. And I recently had a scare with Cooper with one of them. So we are going to cover mast cell tumors and melanomas because I think they both have some things that are good to cover together. And Cooper, my dog, so if you're new here, I have an 11-year-old black lab. His name is Cooper. He's the best dog in the whole wide world. And he recently, last week, noticed a growth just below one of his lower lips. I just was like petting him and felt it, and it was like a round, hairless, dark, pigmented tumor, and it was new. So anyway, I biopsied it. So I did what's called an excisional biopsy. I took it in its entirety, sent it to a lab, just got the results today. It is a benign tumor. It's called a hamartoma. I was worried it might be a melanoma, so we'll get into that in a minute, but it's not. So I'm very relieved, and I thought, that's what we'll talk about on the podcast today. So we're going to cover that and mast cell tumors. So we're going to jump right in, and we'll start with mast cell tumors. So if you've never heard of a mast cell tumor, again, it's something that we diagnose pretty frequently in vet med. They're more common in dogs than cats. If we see them in cats, we're usually more concerned, but we see them in a lot of dogs. So let's talk about what they are. So basically, mast cell tumors are tumors that occur because mast cells, which it's important to understand that mast cells are in all dogs and cats' bodies. So the actual type of cell, mast cell, is a normal part of the immune system. Mast cells release different things, including histamine and some inflammatory mediators. So mast cells are part of an immune reaction to different things. So we will see mast cells when we look at cytology slides from inflamed areas sometimes. But a mast cell tumor is the overproduction of those mast cells, and it can become a malignancy. And so we see these a lot. Like I said, there are some breeds actually that get mast cell tumors a lot. So when vets or vet techs think about mast cell tumors, we think about boxers, Boston Terriers, pugs. Labs actually get a lot of mast cell tumors. And again, they're less common in cats. An interesting thing about mast cell tumors in some of these breeds that get them a lot, I talked about this in our boxer episode recently. Boxers are the poster children of they get mast cell tumors a lot, but they usually get less aggressive mast cell tumors. So we have to watch for them, but usually we can treat them fairly easily. So what do they look like? So mast cells, I always tell vet students or young vets that I'm helping or talking to that mast cells can kind of do whatever they want. So they can look a lot of different ways. Sometimes we see mast cell tumors. They're often on the skin in dogs, or just under the skin. And the ones that are on the skin can get really angry. So they can look really red, and they can even sort of ooze, and they can change in size. This is one thing that can tip us off that maybe we have a mast cell tumor, is someone tells us, yeah, they had this growth and it got bigger, but then it got smaller. And just because of the type of cells that make up this tumor, that can happen. And that's not very common in other types of tumors. So they can, like I said, be on the surface of the skin. They can be under the skin in what we call the subcutaneous tissue. Mast cell tumors can also form or affect organs. So liver, spleen, and GI tract, intestine, stomach. What's interesting is that in cats, we can see mast cell tumor in the spleen. If we're going to see it in cats, it often is in the spleen, which I'll talk about a little bit later. It's very cool. I've had a couple cases of that. So that's what mast cell tumors are and what they look like. So what happens when dogs or cats have mast cell tumors, especially in their skin or sub-Q tissue, like I said, they can have swelling and redness around them. They can become ulcerated. And if they have a lot of them or have really big ones and they get irritated, they can actually release so much histamine and other inflammatory mediators, they can cause some systemic problems. So they can have stomach ulcers, they can suddenly have low blood pressure, they can vomit and just not feel well because they just have so much release of all of those substances from all of these mast cells in these malignant tumors. So when we see mast cell or suspected mast cell tumors as vets, we usually are going to recommend that we aspirate that growth. And really, your vet should recommend or offer that for any growth that's big enough to get a sample from. I often hear people tell me their vet recommended that they just watch a tumor, and that's not really usually the best advice. Now, if people have cost constraints and they can't poke a mass right away, that's a whole other conversation. But doing a fine needle aspirate where you put a needle inside a growth is a very easy test to do. Any general practice vet can do it. And that is how we diagnose or find these types of malignant growths early on. So I always tell clients that mast cell tumor is one of the few types of tumors or cancers that we can just in the clinic as GP vets get a sample of, look under the microscope, and be fairly confident that that's what it is. So that's one thing I really like about mast cell tumors or treating them is that I can diagnose them myself and we can know what's going on and come up with a plan right away. And so we can get that fine needle aspirate, we look under the microscope, and we see in that sample just tons of mast cells. So that's not normal. Seeing a couple, maybe normal in an inflamed area, but just a slide full of all mast cells is abnormal. And that tells us this is likely a mast cell tumor. And then we often will also, we'll say, hey, we have a mast cell tumor, but we cannot tell an owner how aggressive or invasive that tumor is often in the clinic. So often we have to get more information. So we can send that cytology out to be evaluated by a pathologist, or we physically remove the tumor and send it for histopathology, where that tumor can actually be graded. So, like I said, we diagnose with an aspirate, but then we grade to know how aggressive it is with more testing. So more involved cytology or histopathology where the actual tissue of the tumor is looked at. Something else we can do with mast cell tumors is what we call staging. So grading and staging, when we talk about cancer, are two different things. So staging means is the mast cell tumor in other places besides just this growth that we have found. So lymph nodes are one place we check for other signs of abnormal mast cell activity and mast cell tumor. Blood work, we make sure blood work looks okay. And then ultrasound of the abdomen will tip us off if there's any visceral tissues, so any organs within the abdomen that look abnormal that could also be affected by mast cell. And then x-rays of the chest. X-rays of the chest are usually a part of staging for any kind of suspected cancer, because that's one place that a lot of cancers will spread is in the chest, and we can see that on chest x-rays often. So once we identify that your dog or your cat has mast cell tumor somewhere, usually what we're going to recommend is surgery. to remove, especially those cutaneous mast cell tumors. So those tumors that are on the skin or just under the skin, sub-Q ones. So surgery is often recommended to remove them. Sometimes we find multiple mast cell tumors at the same time, so we take all of them at once. There is a newer treatment option for mast cell tumor that's very interesting and gaining more popularity. It's called Stelfonta, and it's an injection, and that medication gets injected directly into the tumor, that's mast cell tumor, and it causes death of the cancerous cells and it necroses. So that tumor actually necroses and goes away, but it causes a wound where the tumor was. So all the tissue where that tumor is also necroses. And so those dogs end up with a wound where their tumor was. But it's a very cool treatment modality. It can't be used for every type of mast cell tumor, but for the ones that are good candidates for it, it's very cool because it doesn't require surgery, doesn't require sedation usually. It's just very carefully calculated how much to inject into that, and then wound management from there. And it's not normal wound management. Those are to be left open. You do not all veterinarians do Stelfonta. So oncologists definitely do Stelfonta. Not every one of them, but ones that use it can do that. But then general practice veterinarians can use Stelfonta. They typically are going to go through some training on how to use it properly, and then they can do it in their practices. I definitely want to start using Stelfonta. My friend, Dr. Sue, is an oncologist, and she's a big fan of Stelfonta. And so I need to she'll say rah rah, yes, we need to get trained so that I can start using Stelfonta. So if a dog isn't a good candidate, their tumor's not a good candidate for Stelfonta, the injectable treatment, then or for whatever reason we need to remove that surgically, so we'll do surgical excisional biopsy of those tumors. So when we take a suspected mast cell tumor, regardless of the grade, because often we don't know before surgery, we try to take wide margins. What does that mean? Wide margins means we want to take all of the tumor, all of the cancerous tissue, and then as much of the healthy tissue around it as we can. And when we talk about a tumor that's on or in the skin, we also talk about fascial planes. And so there's a lot of layers to the skin, and then under the skin, there are layers of different tissue before you get down into muscle, right? That's under the skin. So there's layers of fascia between skin and muscle. And so when we take a mast cell tumor from the skin, not only do we want to get wide margins of healthy tissue around it, we try to get at least one layer of fascia or two underneath, or fat. So we want to get as much around the entire perimeter of the tumor. And then we send that tissue out to a pathology lab where a veterinary pathologist can read that histopathology, and then they're able to give us a definitive grade of that tumor. And the grade tells us how aggressive it is, how likely it is to come back, or how likely it is to be already have spread to other tissues like lymph nodes and the abdomen. Another piece of information we get on a histopathology report is those margins. So a pathologist is able to look at the tissue that we send, if we've done it correctly, and say there's this much healthy tissue, cancer-free tissue around that you've taken out. And that just tells us, again, especially with a low-grade mast cell tumor, how likely it is to come back, which if we've gotten good margins, it's very unlikely that that specific tumor will come back. Now, I will say if we're talking about a dog like a Boxer or a Boston who get a lot of mast cell tumors, they can get more mast cell tumors. They just won't get regrowth of that one that we took. Some other things to know when we talk about mast cell tumor is that there are some medications that we use often to help manage it and treat it. So steroids and antihistamines are often something that a GP vet might recommend after we've aspirated a growth. We know it's mast cell tumor. Often we will put them on a steroid and an antihistamine like Benadryl, diphenhydramine, or famotidine, which is Pepcid. We'll put them on those medications because they can reduce the size of that tumor so that when we go to do surgery or Stelfonta, I think you can do those before Stelfonta. Don't quote me. We're going to have a Stelfonta episode. Then the size of the tumor can go down before we do surgery, which allows us to get better margins because we have more tissue to work with. There are chemotherapy options as well for mast cell tumors. So this is often used in higher grade mast cell tumors, even after they've been removed. And then again, there are some targeted therapies. So radiation is sometimes used for cases of mast cell tumor. I had a patient in the last couple of years, loved this dog, who I actually diagnosed with a mast cell tumor, and it was like within her lip. And so she did some radiation treatment after some surgery and chemo because they couldn't get complete margins of the tumor, and it helped her a lot. And then again, there are some medical supportive therapies like gastroprotectants to help if we're worried about GI problems because of all the histamine that's being released by the mast cell tumors. So remember I told you that cats are unlikely to, or less likely to have mast cell tumors, which is true. So a lot of dogs get mast cell tumors. Not a lot of cats get mast cell tumors. They can have them in their skin. Mast cell tumors are often like low grade in cats, not a huge deal. But cats that get mast cell tumor often have it in their spleen. It can also be in their intestines. What's interesting about cats and splenic mast cell tumor is that if they have it, then removing the spleen is often curative. So it's often isolated to the spleen. This is just an interesting fun fact. I have had a case of mast cell tumor in a cat. It was an older cat who was losing weight, not doing well, vomiting, and I was seeing it for the first time, palpated its abdomen, and I could feel this cat had like a tumor in its abdomen. And it turns out it was its spleen. The spleen was huge in this cat. Finances were limited for this case. So we actually did a fine needle aspirate of this cat's spleen, which has some risk. They can bleed. And so I put a needle directly through the abdomen into the spleen, put those cells under a microscope, and could see it was just full of mast cells. So I did a splenectomy on that cat. We removed the spleen. It was, in fact, mast cell tumor. We didn't find any evidence of mast cell anywhere else in the cat's on an ultrasound, lymph nodes, GI tract. And that cured that cat. That cat did so great. Owners definitely thought like the cat was going to need to be euthanized soon, but she did great. So interesting thing about mast cell tumor in cats. So those are the big points about mast cell tumor. I think mast cell tumor it's a great diagnosis for a lot of patients because often they're low grade. And so just surgical removal can take care of them. People often hear the word tumor, pet owners, and they panic. And so I try to tell people, hey, like this is a type of cancer, but a lot of them are very treatable, especially in those breeds like Boxers and Bostons who get them a lot. So they're not always a reason to panic, but they are a reason to always have your vet look at a growth that you notice, some big kind of tips that it might be a mast cell tumor is if it's a growth on the skin that looks inflamed, it's red, it might be ulcerated, or it's changing in size. Those are kind of tip-offs that this could be a mast cell tumor. Okay, so now let's talk about melanoma. I also realize these are both tumors that start with an M. So melanoma is what I was worried Cooper might have. Melanomas are tumors, and they are made up of melanocytes, which are pigment-producing cells. So again, melanomas are more common in dogs than in cats. And we see these often around the mouth. We say oral melanoma. We can also see them on the nail beds, so on dogs' toes close to their nails. And then we also see them on the skin as well. Their location often predicts what they do. So we can sort of kind of tell how bad they're going to be based on where they are. We'll talk about that in a second. And then in cats, again, they are pretty rare. If we're going to see them in cats, they're going to be usually in the eyes or the oral cavity. There's not a ton of research about melanoma in cats, I don't think, because they don't get them a lot, which is good for cats. So So melanocytes are cells that produce pigment, and so they're already present in pigmented areas like skin, oral mucosa, nail bed areas, and they can be benign. So we can have benign melanomas and we can have malignant ones. And so Melanomas that form around the mouth and the nail beds are usually malignant. And these are usually going to be the more aggressive types of melanomas. So they can invade local tissue, and then they can also spread to other organs. The lungs, like I said, are a very commonplace. Melanoma can go, and they usually do that by getting into the lymph nodes. Now, on the skin, if you have melanomas, cutaneous melanomas, what we call them, just on skin anywhere, they can be benign, but we won't know if they're malignant or benign until we take them and send them off for histopathology, for a pathologist to look at. So melanomas look very different from mast cell tumors because they're often pigmented. Now, there is a kind of melanoma that isn't pigmented, but they're often dark, so they're often kind of black. And they're usually going to be like a raised little tumor, little growth on the skin. They can look a little shiny. The skin's usually intact. They often have no hair, so they kind of arise out of the hair. And like I said, they're usually dark. So we can diagnose that this is a melanoma from a needle aspirate, like I was talking about with mast cell tumors. And GP vets can look at an aspirate from a growth and say, I'm worried that this could be a melanoma, but we often rely on a pathologist to look at that cytology sample to tell us that they think it's a melanoma. And then, like I said, similar to mast cell tumors, then we would remove that tumor. We would get histopathology. So pathologists look at the actual tissue, confirm what it is, and tell us how aggressive it looks. We also do staging for melanomas, like most cancers. So typical things to include, like I said, chest x-rays, lymph node aspirates. Are they in the lymph nodes? And then if we are worried about it in the mouth, we can take x-rays or a CT of the mouth and head to see where does this invade? Is it anywhere else? And then there are cases where we have melanomas that are not pigmented, and there's some kind of special testing that can be done for those. So when we identify a melanoma in a dog or a cat, rarely, or we suspect it, often we're going to talk about surgery. So especially if this is in a place not necessarily within the mouth, but maybe around the lip or the nail bed or on the skin, that would be a candidate for surgery most of the time. And so we would pursue that with wide excision, like I talked about with mast cell tumors. So we would want to take the tumor and then tissue around it. Just so you know, because they do often form on the toes, that's usually going to be a discussion about amputation of one of the digits of one of the toes. That's the best way to get good margins around it. The one good thing about tumors of the toe is that you can amputate toes, and often that doesn't have a big impact on quality of life for the dog. So wide excision, we want to get as much healthy tissue around the cancerous tissue. And then chemo, radiation are two treatment modalities that an oncologist might recommend after that. Radiation, I know, is something that is used somewhat commonly if it's available, if we have oral melanomas. Chemo, I think, from what I understand, is not as effective as it is for some other types of tumors and cancers. There is a melanoma vaccine. So this is basically immunotherapy for a dog's specific melanoma tumor or cancer. So this can be used once you take a tumor, you send it out, and certain labs can create the melanoma vaccine for that dog for their specific tumor. And this is sometimes a good choice where we take a melanoma, we've gotten it all in surgery, but we want to use that to just try to knock out any microscopic disease. So when we talk about tumors and cancers, we often think about prognosis. I didn't really talk about that in mast cell tumor because there's such a wide range of prognoses. In a low-grade mast cell tumor that we've taken out with wide margins, great prognosis, that's often curative. With melanomas, there's quite a range here. So if we find one and it ends up being benign, or it's a cutaneous skin melanoma, those have good prognosis. So if we get those, if they're benign, excellent prognosis, not going to spread anywhere. Even if it's malignant, not aggressive, we get it with good margins, there's a good chance we've taken care of it. But when we talk about oral melanoma or melanoma around the nail beds, around the toes, those have not so great prognoses. So depending on what type of treatment is pursued, survival time based on studies for melanomas of the mouth or the toes is anywhere from 6 to 18 months. And that time difference has a lot to do with the stage. So is it anywhere else? Is it in the lymph nodes? Where is it? Were we able to take it? Were we able to get good margins? Are we doing chemo, etc.? Prognosis is hard to predict. It's not always a formula. It's something that you often really need to discuss with an oncologist about. And I think it's important to know that with both of these types of tumors, yes, your GP veterinarian can manage a lot of that. But it's never wrong to go to oncology just to get a consultation, especially before you make a big decision like surgery, things like that, and get their opinion on what's the best course of action. And then certainly if we find those tumors, we get pathology, we find out they're more aggressive forms. Just know that there are some options with oncologists that can buy a lot of time. I definitely want to have some oncologists on the podcast to talk more about just veterinary oncology in general, because there's a lot of misconceptions about what that looks like for our patients. But these are two different types of cancer that sometimes definitely are followed up with oncology, and it can really help a lot. I think the big take homes from both melanoma and mast cell tumors, like I said, is that it's never too early to do at least a fine needle aspirate of a tumor, unless it's just too tiny to get a sample from, or the way the tumor is, you can't really see. We say it doesn't exfoliate well, hard to get a sample to look at under the microscope. Just waiting and watching a tumor is not a great plan, because even sometimes vets will feel a tumor and it can feel soft. It feels like a lipoma, which is a benign growth. We can say it seems like that's what it is, but we just don't know unless we put a needle in there and check. And we can keep body maps of our patients. So as lumps and bumps pop up, we can have a master literal map of their body where we keep up with where we've poked growths. And when we think about melanomas and mast cell tumors, they're two growths that we really want to catch those as early as possible. So it's a reason to be proactive, put the needle in the tumor, have your vet do that, and look at it under the microscope, see if we're worried about anything malignant, have a pathologist look at it, do a cytology. And again, they both can be a little bit unpredictable. They can pop up in different places. They can look different ways. And so anytime you notice any kind of new lump or bump, it's always a good idea to get them checked out. So I hope this was helpful. I'm sure many of you have experienced mast cell tumors. Some of you have probably had pets with melanomas. I would love to know about your experiences, your questions. Please know you can always send me a DM on Dr. Molly Says Pod on social media with any specific questions you have about this or any subject requests for future episodes. Make sure you're following me, Dr. Molly Says, as well as the podcast, Dr. Molly Says Pod. Make sure you're subscribing to us wherever you listen to podcasts. You can also watch this on YouTube. So subscribe to our channel if you're there. So I will see you guys next week. We have some really fun interviews coming up in the next couple of weeks. So stay tuned for that. Some friends and some cool people with great things to share. So I will see you next week on the Dr. Molly Says podcast.